Hey guys, welcome back to Declassified. I'm so excited for today's episode. I have on with me an expert in the field of aesthetics and laser medicine. She has over 13 years of experience. She's helped me with my own personal skin journey and so many others. Please help me welcome one of my very good friends, Cheryl Hazen. Thank you so much for being here.
Thank you for having me on. This is awesome.
Yeah, I know that everybody's going to love hearing from you. And we all know that skincare and like taking care of our skin is so important, but it can be really confusing because there's just so much information out there, so many different products. So it's hard to know like what to use or what's right for you.
Right. And that's how it's different in the 13 years that I've been in the industry is that when I first started, yes, social media was around, but it's not like it is now. And so when I scroll through, being in the industry, I know what to look for, but I think about the lay person who is over flooded with all of this, and I'm sure it's hard to figure out like what do I do, what's the right thing to use, do I do a laser, do I do injectables? It's hard.
Yes, it's hard to know what's right for you, especially when there's so many different conditions. Like people are fighting melasma and wrinkles or redness. There's just so much to kind of like dive into. But our goal today is to really like uncomplicate it for people because it can really just, there's so much to be said for a simple routine and just taking it back to the basics. And then we'll also touch on like procedures such as like laser treatments and microneedling. And like, I know, me too.
My favorite.
You guys talk about like we just did my second round of microneedling and it's just, I'll have to put my before and afters in the
So
video
good.
version of the podcast, but I know because they're so good. But those before and afters kind of speak for themselves. So
Yeah.
we'll dive more into that kind of later and like when to do the procedures and when you probably, it's not really right for you. And then we'll talk about towards the end, we'll debunk some skincare myths out there. So
I'm
it's
excited.
going to be a really good episode. But take me back to like when you started because 13 years is such an incredible resume. So did you always know that you wanted to be an RN?
Yes, I knew I wanted to be a nurse ever since high school. I've been in healthcare since my senior year in high school. I worked in a nursing home.
Yeah. Oh my gosh.
And all through nursing school, worked as an aide in the hospital back in Nebraska, where I'm from originally. And then actually my first job was at Mercy in the PACU, in the anesthesia, post anesthesia care unit, waking up patients. And I kind of fell into aesthetics by accident.
Really? How is that? Because it's like you went from
Yeah.
really like helping people, especially in like nursing
Yeah.
homes and helping people wake up from surgeries. That's such like a huge like
Opposite jump.
Yes,
Yeah.
absolutely.
Yeah.
So how did that happen? You're
So-
like, people are waking up from being like knocked out and you're like, your skin looks amazing though.
I know, right? Well, it was funny because I had been there for 6 years. I knew I didn't want to do that forever. And one of my friends who had left the PACU about a year before was coming back up because she lived about an hour and a half down south. And she's like, hey, a bunch of us are getting together. Let's all like meet up. And so there was a handful of us that went down and we met up and I was talking to one of the docs that she was working for and they said, hey, how's the hospital? I'm like, actually not loving it. I had already applied at
It
a
wasn't
couple
your
of
passion.
Yeah, I'd already applied at a couple of teaching jobs because I had just gotten my master's in nursing education. I knew I didn't want to teach nursing school. Just really wasn't sure what I wanted to do. And they were like, hey, this facial plastic surgeon's looking for.
I didn't know you had a master's in education. That explains why you're such a good teacher. Because you teach for, is it at the Laser Institute or?
So I taught for 2 laser companies, 10 years ago now. And now I teach for 2 filler companies.
That's right. That's right. But anyways, go on.
Yeah. So anyway, they said, well, this facial plastic surgeon's been looking for a nurse. Are you interested? And I said, sure. I don't really know anything about the industry, but so actually it's funny. I interviewed and they offered me the job. I actually turned it down because I'm like, I don't know what I'm doing.
Yeah. Yeah. You're like a little bit of imposter syndrome. You're like, that's not what I went to school for.
Yeah. Yeah. So they called me back and I thought, well, gosh, if they're calling me back, I should probably take the job and ended up falling in love with it. Had no idea even what this world entailed. So I was truly like a deer in the headlights for the first year.
It's almost like you're going back to school again to relearn everything.
Yep. And then kind of just, like I said, fell into it and learned to love it. And it's become my passion. So
yeah. Well, I mean, who doesn't want to look young forever?
I know, right? But I'll be honest, like when I first started, I had no idea what filler was. Like nothing. I had no idea what any of that was.
Oh my gosh, I'm sure.
A lot of learning along the way. But
let's talk about the basics of a skincare routine. Like what are some things that people should be, like core products that people should be using? Like I'm trying to think of the person who maybe is starting to try a new skincare routine or even like create one and they don't know where to start. Like maybe they don't even know what a toner is or like what moisturizer to use.
Well, and it's funny because I went back to when I first started there, like on how I thought about it, and how I thought about it back then is definitely not how I think about it now. Pillars of a good skincare routine, just the basics. Washing your face, just a gentle cleanser. Unless you really struggle with like a problem skincare like acne or something, just a basic cleanser to just get the makeup and the dirt off.
Yeah. Do
So
you have a preference between like gel cleansers or cleansers that are more foamy? Like, what's the difference?
I like foamy just because I like it when it foams, but there are certain skin conditions for people with like sensitive skin or rosacea where more like the milky lotion cleansers might be a better
That's what
deal.
I use.
Yeah, I was going to say for somebody who's sensitive, better. For somebody who's acneic prone, something with a medication in it, like a salicylic acid wash, is going to probably be better. Or even an alpha hydroxy acid because they tend to be more oily. But for the basic client, it's going to be just a gentle cleanser. You can never go wrong with a gentle cleanser. So
Yeah, yeah.
that's step one. Step two would be a moisturizer, something basic. It doesn't have to be fancy by any stretch. Even something over the counter is something as easy as like CeraVe lotion.
I just was listening to another podcast because I was researching because I'm not a skin expert, but I heard from somebody else that CeraVe like is actually a good one to choose if you don't, because skincare is expensive. Like,
It
don't get
is.
me wrong. Like, we all love Epion's, we all love Elastin,
Right.
but it's
It
expensive.
is. And then
Yeah.
it's funny because you go to, just your regular Target or something and you see all of these choices and you have no idea what to pick.
So you would recommend CeraVe?
CeraVe, just because it's a basic, there's not a lot of extra ingredients in it. It's just a general good moisturizer until you kind of figure out what your skin type is if you're new to the game. And then hands down, you have to finish with a sunscreen during the day. That's going to be your best bet to preventing any kind of aging is sunscreen. And I remember
Mhm.
when I first started using sunscreen, I'm like, why do I have to put it on every day? And you think about like in your house or when you're driving somewhere, you're constantly exposed to UVA and UVB radiation,
Constantly.
which is going to break down your collagen and it's going to speed up the aging process. So you really do have to put an SPF on, not in your makeup. It has to be separate because then you think about how much we touch our face during the day. We're wiping our hair out of our face, or you're sitting there, with your hands in your face at the computer. Like we touch our face way more than what we
All the
think.
time.
So we really need that base sunscreen before makeup.
Yes, absolutely. So, because some tinted sunscreen or moisture, I'm sorry, tinted foundations have the SPF in it.
They
So you're
do.
saying put it on first and then maybe apply that foundation too. So you're like double protected.
Yes, because most foundations will only have an SPF of 15
Yeah.
typically, and
Hmm.
the American Academy of Dermatology will recommend at least a 30.
Okay.
So you want to have a base sunscreen before you have your anything in your foundation is just extra.
Yeah.
So
Yeah. So do we touch on toner at all?
we did not. I am not a huge toner person. People love it. That's kind of like the old school. So the idea of a toner is to get your skin prepped at the right pH to allow products that you put on after to penetrate better.
Yeah.
Personally,
It can be given give or take basically.
yeah, and they're better now than they used to be. I mean,
Hmm.
I'm older than you, so in the old
Which
days,
you do not.
I
That is such a true testament to like how good you are at your
yeah.
job because you do not look your age at all. Like, and I always say that because people like about myself because people think
Mhm.
I'm younger than I really am. You
Right.
guys, I'm 35 years old, but Cheryl,
29.
yeah, forever 29.
Forever
But
29.
no, people think that I'm like in my 30s. Like, what, they think that I'm 30. So
I know, I love it.
yeah, I know.
So
So
great.
it's a great thing to be.
Mhm.
But yeah. So toners give and take.
Toners give and take. They're made so much better now. Like they have them that they're more balancing so they don't strip away, they don't lower it too much, they don't excessively dry you out. So they're better now. I just kind of got out of the habit of using them. I don't think they're bad. I just think you have to be careful if you're more of like that sensitive skin type. They can be a
Yeah,
little
okay.
harsh.
So maybe just if you're just starting and maybe even if you have a budget, like try to just get that gentle cleanser first,
Then
the
the moisturizer,
moisturizer,
the
and the
sunscreen.
SPF.
Yes,
So
for
those
sure.
three. Is there anything else that you think people should add if they're just starting? Or just like start with that and see how your skin reacts? Because I feel like some people they make the mistake of buying too many products and then they have like 10 and they're thousands of dollars deep and they're like,
I cannot tell you how many clients I see come and sit in my chair and they're like, my skin is a mess and I don't know what to do. And I'm like, well, what are you all using? And they're like, well, I use this and this and this and this. And
HA, vitamin C, retinol, liquid filler.
I will tell you the people who have the best looking skin use the basics, and I think mostly it's because they keep their skin barrier intact, and that's what I think people forget, that we have this upper layer of skin barrier that's made up of cholesterols and free fatty acids and water. And when we use too many products, we break that barrier down, and when our barrier is broken, it basically allows for little holes in our skin, and that allows for more inflammation, and all these other things that lead to an increase in aging. And for the people that I see their skin look the best, they actually use not as many skincare products, and they're more aimed at using moisturizers and other things like that, as well as SPF to keep their barrier intact. Because once your barrier is intact, you really don't let as much aging factors insult the
Repenetrate
skin
the
as much.
skin.
Yeah. So I think that's where we're missing the mark sometimes, is that we get sold in the idea we need 50,000 skincare products. We actually don't.
You don't. I mean, for me, I know I usually I'm a toner girl just because I would say I have like I know we talked about this yesterday, but I have a hint of rosacea. I would argue I probably do have rosacea. You couldn't tell now just because of all the treatments that we've done. But I mean, I just do the gentle cleanser, the toner, the moisturizer, which like it's like, a intensive moisturizer because I'm super dry.
I would say we upped you.
Yeah. But and then, every now and then I'll throw in like a vitamin C, but that's pretty much the what my skincare routine is.
I was gonna say, I
It's
can
nothing
tell since we upped
crazy.
your moisturizer, your skin hit your hydration
Yeah, the
level.
Elastin Intensive
Yeah.
Moisturizer, it's just where it's at.
Yep.
The other one was good too, but I just needed more. I needed more because I run drier, which is great. Redness and dryness, it's a great combination. Yeah, so are there any other, mistakes that you see people using or mistakes that you see people making?
We have, I feel like I see skincare transitioning now as the use of medicated pads. Back in my day, it was good old Noxzema. And they're
What is
very,
that?
it was so bad for your skin. It was made so poorly.
Really?
But now we have these medicated,
Like exfoliating pad?
exfoliating pads that will have, alpha hydroxy acids, they'll have beta hydroxy acids. Some of them will have retinols in them, which is great. But the problem with pads is they tend to be more potent. So for somebody with sensitive skin or dry skin, it's really going to kind of tear their skin up.
Yeah.
And so frequently what I see is overuse of these kinds of products, because I think, well, I need this for anti-aging. And the goal of these acids and these treatments really is to just speed up skin turnover, because our skin naturally turns over about once every 28 days.
Right, there's no turning back the clock.
As we get older, that process gets longer, and right, and so the less we turn over our skin, the more dull it looks and the more aged it looks. And so the idea then of those medicated pads or even our topical retinols, the other topical treatments like that, is going to be to speed up skin cell turnover,
Mhm.
because that keeps our skin looking more uh, like less aged and more hydrated, right? But if you do it too much, then you end up causing inflammation and dryness, and then that actually makes your skin look worse.
I've noticed that with the exfoliating pads I use, like, I used to wanna use them every day because it was
You
also
think more is better?
yeah, and then I was also kind of like I noticed that some of my makeup that I missed in my cleansing would come off in the exfoliating, and it's like, "Okay, I need to realize this isn't a makeup remover, and I need to use it maybe sparingly, maybe, like, once a week." And you also think about the application with when it's a pad, you are literally rubbing it across your face,
Which
and
is
it
also a
you
form of
need to you
exfoliation.
need to be gentle, you
Yes.
can't be, like, pulling on your skin and
Yes.
stuff like that.
And we forget all the other things we do when we're doing our skincare, just I use my fingertips. There's a lot of people who choose to use a washcloth or they'll do other things. And then when they dry, they're taking the towel and they're rubbing their face. Those are all forms of exfoliation. It's mechanical exfoliation versus a chemical, like with your pads, the medicated pads. It's still exfoliation. And we just don't need to exfoliate that much, because the more we exfoliate, again, the more we break down our barrier and we let more aging factors affect our skin.
Yes, that makes so much sense.
Yeah.
Is there any ingredients that people should be looking out for, like in their products, whether it's over the counter or through like a
So,
medical?
so I think the biggest thing for over the counter versus medical skincare is that over the counter, you're going to find less potent ingredients and they're not as pure. So while they may work for some people, especially like our sensitive skincare people, over the counter typically is fine. For somebody with thicker skin or more oily skin, it just may not be strong enough. And that's where we tend to push people towards medical grade, because it's a higher concentration. The active ingredients are more pure, and those kind of products are going to be more studied via research too. So we know that they work. And so for everybody, and they say, well, gosh, it's so expensive. They are. You don't have to buy everything from there. Maybe you just choose to buy a treatment from there because, again, the ingredients are more pure and they are a higher percentage. So they're going to be more effective, if that
Mm-hmm.
makes sense.
Yeah, yeah. And once you get into procedures too, and we'll talk about that a little bit later, it kind of makes it so you don't have to buy so much skincare or use so much of your topical stuff because your procedures, the treatments, even like laser, like V beam, can take your skin health to the next level.
And that's, I think, where people go wrong too is that they expect a lot from their skincare routine, and we have to remember that their skincare routine is really just to kind of keep our skin healthy. It's like
It can only take you so far.
yeah,
Yeah.
yeah. It's a step in the process. A good step, albeit, but if you're looking for something more, skincare is not going to get rid of your wrinkles.
Yeah.
It just won't. It doesn't build collagen. And that's the thing is that after the age of 20, we just don't make collagen anymore on our own because
Really?
mhm,
That young? Oh,
that
wow.
young, because what happens is every year there's a slow, steady breakdown. It's such a slow breakdown that our body it kind of flies off the radar. Our body doesn't see it necessary to repair it unless we tell it to repair it. And that's where lasers and peels come in, is that we make these controlled injuries and we're basically telling your body, hey, go make some more collagen. And that's how we get more collagen production, is by doing these kinds of procedures. And that's how they help with the wrinkles, or they'll help decrease redness or sun damage or something like that. But yes, that's a lot of times skincare just isn't enough. It's good to maintain, but the lasers and the peels will kind of help treat those things that skincare can't get to. It just doesn't penetrate deep enough to do that kind of.
Yeah, that makes sense. So on a side note, like with collagen, do you recommend or do you have an opinion on like collagen supplements?
I get that a
Do you
lot.
think they're good? Like,
They're not bad. I don't think that they don't hurt anything. I don't know that they're that helpful to ingest it. Our digestive system doesn't digest it as well. It doesn't.
how do you get from your stomach to like your skin barrier, you know?
Correct. And I think it probably does help maybe with like skin hydration. Maybe it helps make our hair stronger, our nails stronger, things like that. And like I said, better improves skin hydration. I don't know that it necessarily will do anything for wrinkles, but it obviously doesn't hurt. I just don't know that you're going to get that much
Like maybe the
benefit.
science isn't there quite yet.
Yeah.
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 So the new popular ingredient seems to be
Hyaluronic acid.
hyaluronic acid. Hyaluronic acid. I was like,
Yeah.
wait, how do you say that? I almost said
Yep.
hydronic or hydroponic. We're definitely not going to talk about hydroponics today. So why is that so unpopular? I feel like everybody's talking about
I don't know. I don't know if it's the whole TikTok era. I don't know why that picked up with such a massive momentum behind it. Hyaluronic acid is basically, I call it a hydrator. So hyaluronic acid is going to penetrate deeper into the dermis, because for some people, they lack the hydration deeper in their skin. So an HA is great for somebody who lacks that deeper hydration. Whereas a moisturizer is going to be more oil based for the people who aren't making enough oil in their skin. And sometimes we need both. Like, I'm the kind of person who needs both. I need hydration lower, but I also need a moisturizer that's oil based because I don't make enough oil the way it is. So for like sometimes my oily people, they clearly are making enough oil at the
they don't
surface of their
need the
skin. They don't
HA.
need a moisturizer.
Hmm.
But they might be dry on the base layer, so I might give them an HA but not a moisturizer.
How does this look like for, I know we talked about your collagen kind of stops producing at the age of
Yeah.
20. So how does that look whenever people turn 20? Should they start thinking about procedures? Is that the line where you're like, okay, you need to start introducing maybe treatments, laser treatments, microneedling? What age should people start thinking about that?
It's so funny. I get this question a lot. I don't think there's a right or wrong answer to this. I started doing lasers.
Because everyone's
I
different.
know. I started doing lasers because I was in the industry a year after I started my job at 28. So I've been doing them for 12 years now. I routinely do at least one once a year, maybe twice a year. It kind of depends on what my skin's doing. But I come at it from a different angle where I do them to improve my skin health. And for me, like in the industry, I'm a person that recognizes patterns, and I recognize pretty quickly the clients who did regular laser treatments as they aged, their skin looked a lot healthier. And for me, like, sometimes the injectable treatments that we do are kind of taboo. People,
Yeah.
people don't want to talk about it. Yeah,
We're
but
going to talk about that
yes, we
too.
are. But healthy skin is always in. I mean, I think when you have healthy skin, you emulate that appearance of health. And so I'm always a big fan of that. And they just came out with a new research that non-ablative fractionated lasers can reduce your risk of skincare up to 50%, which
Wow.
I think, why not? Why not do
Absolutely.
them if I can reduce
Absolutely.
my skincare or my
Yeah,
skin?
that's the scariest thing. I'm always like, I'll see like a mark on my body or my face, and I'm like, oh my gosh, I have skin cancer.
Well, I always think like, yes, skin cancer is terrible and would I want it? No. But I think on your face, you can't put a bag on your face. You can't hide it. So I've been involved in those kinds of surgeries where we have to reconstruct the face because there was a decent amount of skin cancer taken out, and subsequently skin that was taken out, and that's deformative for some people. Whereas if it's on your body, obviously a lot of times you can hide that scar. You
Yeah.
can't on your face.
No, that's your first impression with
Yeah.
everybody, so
Yeah.
you wanna protect it, and I guess, I mean, we think about, like, putting on skincare on or not skincare, SPF on babies too, like, we start that young, thinking of the damage of UV rays and just protecting our skin health, so, if you start later, like, if you start when you're 20, your skin is gonna look a lot different whenever you're 40 compared to somebody who started when they're, late 30s. Yeah, so maybe starting earlier is best.
And I think you think about too, like our face is the thing that's most exposed. Like oftentimes if we're out, walking or whatever, we have clothes on, but this is always the most exposed. So why not protect it?
Yeah,
And why
and
not
wear
take
wear
care
a
of it?
hat.
Yes.
Wear a hat, use your SPF, buy some cute hats.
Yep. Yep.
We just did my second round of microneedling, and I am so excited to talk about this because it's made a huge difference in my skin. Like I said, I did 2 sessions, and I guess they were about a year apart
Yep.
or so, which is, would you recommend doing them yearly? Or, like, how often should we be doing laser treatments
You know,
or
I
microneedling?
think it kind of depends on what you're treating when you do them. So for you, I'll back up a little bit. We often hear microneedling is this great treatment, and it is, and I'm not downplaying that, but I do think it kind of got hyped up a little bit too much in our industry, um, on based upon how most people do it and what they do it with. Meaning, I think about microneedling as a great way to do drug delivery, meaning so like anytime we do microneedling, there has to be some kind of serum that we use to allow that pen to glide across the skin as it makes those little needle marks in the skin. They're very microscopic, right? So most oftentimes these devices, there's multiple different companies that sell them. They'll recommend just using a hyaluronic acid for a glide, so to speak, which is fine. The problem I often see is, I'll have clients come in and they'll be like, "Well, I did 4 treatments and I didn't really see anything." Where I think about microneedling is kind of standing out more is doing it as a drug delivery like we did with you, where we're utilizing medications and different ingredients to help stimulate more collagen. Then I think that's where you really truly see microneedling shine, is by doing it as a drug delivery, which is a huge area of research now.
And
Yeah.
that's what's special about the one at Renu Med Spa, which is where you practice
Yeah.
now, which is in
Yeah.
Cottleville, Missouri. If anybody is local to St. Louis, highly recommend that place. But
I love it.
yeah, it's great. But the magic eraser treatment, which is microneedling, RF microneedling, it includes Botox and exosomes, and what was the other one? Tranexamic acid.
Tranexamic acid.
Yeah.
Yep. It's
Yes.
one of those drugs that was not intended in the aesthetic world, but kind of like some other drugs where we intend it for something else and we realize it has other benefits. Tranexamic acid is actually a great anti-inflammatory, which is why we use it in there. But it's interesting when we talk about using Botox, people think, "Oh my gosh, I don't want my face frozen." I'm like, "No, no, no, no. It's going into your skin."
Totally
Yes.
different than an injection.
Yes. And so we know that by research, intradermal Botox will help inhibit mast cell production, which mast cells will increase inflammation in the skin. And we know that chronic low grade inflammation in the skin is a precursor to aging, right? So when we can inhibit inflammation, which is redness, it's going to help decrease our aging. But also Botox in the skin will help decrease pore size because it
I've noticed personally.
that
I'm gonna put
little.
my before and
I
afters
know,
just
right? It's
right
so
here.
great. So great. Um, because it paralyzes that little rector pili muscle, the thing that makes us get goosebumps, because that muscle is very sensitive to touch. And so when we, touch our skin, it's going to stimulate that muscle, which will help produce oil, right? And so we'll notice that as we paralyze that muscle with the Botox, that it doesn't get stimulated. So we release less oil. So our pores shrink, but also I think you'll notice that you have like less oil. So it's
Yes, very much. Like, you can see in the before and afters that the difference in the oil control, like, in the skin brightening too, like, my skin is so much brighter and I literally have nothing on.
And that's because we reduce that inflammation in your skin.
Yeah,
It just
yeah.
allows it to shine a little bit. And then we have the exosomes, which is it's basically like stem cells, but they're safe. I think there was some concern for a long, long time, at least when I first started, that if we can stimulate the production of new healthy cells, how do we ensure that we don't stimulate the production of bad cells? But over the last 20 years, they've shown that that doesn't happen. But it actually will help repair damaged DNA. So all the times that we were out when we were younger and we didn't put sunscreen on, or our parents, reminded us to and we just didn't listen, it's going to help repair that damaged DNA so that as we get older, we have less likelihood of skin cancer or sun damaged cells or something like that.
Very
So,
interesting. So
yeah.
when you think of microneedling, think of skin resurfacing.
Yeah, yes, it's going to help stimulate collagen because we're making that mechanical injury, but also we're allowing drugs to get deeper into the skin where we wouldn't be able to get them otherwise because there's now a small channel.
So how would you describe for like the layman, like the difference between microneedling and a laser treatment, like
Good
V-beam?
question. Good question.
Like if somebody comes in, they're like, which one should I
I
do?
know, and it gets really hard because all of our social media promoters will promote, "Oh, you should get this laser, this
But maybe
laser."
not everybody needs microneedling.
Yes. So lasers are very different. There's a bunch of them on the market. There's resurfacing. There are lasers that will help reduce redness, like our V beam. There's lasers that are going to help with pigment. And so it really is going to be patient dependent or client dependent, rather, based upon what their goals are. Resurfacing lasers are great. So that's like my Frax Pro. I used to work with Fraxel Restore. There's a bunch on the market, but that's kind of like sandpaper. So that's going to just kind of give you that clean slate. It's going to help reduce wrinkles. It does help reduce pores, redness, sun damage, all of
So
that.
a little bit less intrusive.
Yeah. Instead of making a mechanical injury with a needle like microneedling does, it's going to make a heat based. So lasers sometimes are kind of nice because you get the element of heat, whereas you don't get that with microneedling. So heat will actually kind of bump up the collagen production because it stimulates the release of heat shock proteins in our skin, which is just an added, basically signaling protein that will help us make more collagen. So that's why I like lasers, because you get
Yeah.
that added element of heat. You can't always do it on every skin type. So for like my darker skin types, I can't always do some of those lasers.
Mm-hmm.
But then,
Because you'll
then
damage their pigment, right?
will increase the risk of them hyperpigmenting after,
Gotcha.
and
Yeah.
then they're not very happy when I try to get rid of wrinkles and they end up coming back with more pigment, and kind of a tough, a delicate flower situation kind of thing. But then we have lasers, so for you we do V-beam because you've struggled with redness. For somebody else, maybe they struggle with, just sun damage marks, and so we'll
Or like
choose a different
melasma
laser.
or something.
Or
Is that good
melasma.
for with lasers to treat melasma?
Melasma's tricky
Is it
because anything you can do to help it can also hurt it.
really?
And
Especially
so
because of heat. It's heat. So like it can
it's
be.
correct. So we know that heat is a big factor in the uptake of hyperpigmentation in melasma. Hormones are often a factor. That's why you see it more in women than you do men. But as I read a little bit more, there's actually different causes there's about 5 different causes of melasma pigment, and you can have different types of pigment on different areas of your face, which
Interesting.
makes it really, that's what makes it so hard to get under control. Is, for myself, I have it, my pigment on my cheeks is way different than the pigment on my forehead. And so it responds differently, to topical products and also laser treatments. So it's challenging and people get frustrated, and I get it, because it's like sometimes you do these treatments and it'll look great for a couple months, and then a couple months later you see it rebound. And so for me, like, I tend to watch patterns with these lasers, which is why my face is still a little shiny, because we just
You
played
just
with a
did a
new
Moxie
we
treatment,
yeah, I just
right?
did a Moxie treatment on Tuesday, which is really fun. But I'm always curious, like, I know that it's going to make it better, but I want to see what happens in a couple months.
Yeah.
I've
So do
been
you think that's something that you guys will start offering at Renew, the Moxie treatment? Is that
I'm hopeful. I think it's a great treatment.
Yeah,
And I think, I tend to be a pretty tough critic. A lot of
you
times
are.
reps will come
That's
around
why I
and
love you.
they'll say, what about this laser treatment? And they can give me all the specs, and they can, they're obviously, their job is to sell. And I
Hmm.
get that, but
Yeah.
I want to
But
see the
you're
research,
looking out for your patients.
but also, like, I want to see the clinical results,
Yes.
because I'm the one who's seeing these patients and I'm the one who's recommending them. And if
And
they don't
people
like it
are putting their
afterward,
trust in
that's
you.
right.
Like, yeah.
That's right. So, it's a great treatment. It's actually a pretty lower powered device, which somebody would argue, like, well, why would you want
Is
that?
it a laser or what
It's a
is
laser.
it?
It's
Okay.
it's a wavelength that targets water in the skin, but because of the depth that it penetrates, it actually does great at lifting pigment, which is why
Really?
I've got all this pigment coming out still
Yeah.
here.
Yeah.
But I would argue that sometimes you don't always, more is not always better. And so I
Yeah.
think that's where this company did great, is that it's not overly powered, and so it does great for a lot of different skin types, and it's just a good overall kind of brightening laser. So I'm kind of excited.
Interesting. So
Yeah.
I'm hearing that maybe the deeper you go is for like the pigment issues, and maybe the next layer is like redness.
Well, so lasers will target, there's 3 different chromophores in the skin. So we have water, right? Because our skin is made up of 97% water. We also have blood vessels in our skin, and then we have pigment in our skin. So it's attracted to one of those 3 things. So like most of our resurfacing lasers, like Moxie or Fraxel or anything like that, is going to all, those wavelengths are all going to be attracted to water. We're basically boiling water, which is kind of weird when you think about like, if, okay, if this laser is attracted to water, why is it lifting pigment? And that just more has to do with the depth that it penetrates. It penetrates to the depth that most of that pigment sits. So it will disrupt that pigment and send it to the surface and slough off.
Interesting. And
Yeah.
I want to touch on the blood vessels too, because
Yeah.
that's one of the beauties of V-beam is that it penetrates to those blood vessels if you have redness, like for
Yep.
me, and it doesn't it just like,
It basically seals the inside. So there's a lining on the inside of the blood vessels. And so the
yeah,
goal of that treatment really is to get enough heat to make
like
the lining
zaps
stick
them.
together so that blood can't flow through it. Because if blood can't flow through it, it goes away. And obviously, they're ones you don't need because they're at the surface and they're causing you issues. Yeah. So every laser is a little bit different. And I think in the old days, we used to think, the idea used to be don't do them together because we would fear risk of injuring the skin further. But we now know that by research that doing them together has a very synergistic effect, which is why on you this last time we did V-beam plus microneedling. So we could
Yes.
do both. So we
The
did
best
V-beam.
results I've seen.
Yes, and hands down, I see that all the time. I still think that there's some people out there who are a little reluctant when I recommend doing a couple of different treatments
Because
for
it's a
the.
lot.
It
It's a
is a
lot.
lot, but we see better results when we do
You
them.
do. Like if you have like if you can handle 5 days downtime max, maybe like 4. I think I'm a little bit more sensitive, so I kind of lean towards the latter. But if you can handle being a chipmunk for 5 days, like it's gonna be so worth it.
You should have seen me last year. I was so small. So
Should we put up our
swollen. No,
chipmunk photos? No, we
no,
should not.
no. I don't even look like me in those
Yeah,
photos.
we deleted those.
Yeah.
But let's talk about like Botox and fillers because there's kind of a taboo with them, especially fillers. I think people are scared of them. So, what would you say to people who are hesitant to do those types of treatments?
I would say visit with your injector. I think now, doing injectables, I hate to say it, has almost kind of become a commodity. And I think that more has to do with in the state of Missouri, there's really not a lot of laws governing it. So a lot of people are doing it, which is fine. It gives people opportunities to go to whomever. Um, but it's funny, I had a client in my chair the other day. She said, "Why do I don't really feel like you could screw up Botox?" I'm like, "Oh, but you can because everybody's anatomy is different." And so for like Botox, it's a neurotoxin, and there's a bunch of different ones on the market, but it's aimed at basically shutting down muscle movement, right? Because we know in our face, muscles are attached bone to skin to allow for expression. And so for common areas like 11 lines, we'll use a neurotoxin to prevent lines and wrinkles that form there, right? So we prevent that dynamic movement. And so everybody's anatomy is different. And so I think that's where sometimes people get a little bit nervous because they hear all these horror stories. And likewise for filler, we use filler to replace volume because we know that as we age, we lose volume in our face. And
Especially if
then
you have a lot of baby fat still in your
yeah.
I probably don't have a baby fat, but I feel like I'm just holding on to it. I got a lot of baby
Yeah.
fat.
Well, and for some
But your
people
your
they
skin will start to sag, that's natural.
yes. And
So
I
you
think
want that fullness, you want those, that
yeah.
the cheek line or whatever, the
Yeah.
jawline.
Yeah. Well, and I think for people too, they anatomically they just weren't born with it.
Yeah.
And for everybody, they
Yeah.
age at different rates, right? For some people, you'll see some early signs of aging in the early 30s, and for some, you won't even see it till mid 40s. Everybody's a little bit different, but I think where people get nervous of it is that on social media, we see a lot of times people say, "Oh, I do these natural results," and then you see their before and afters, and you think, "Oh my goodness, like."
You're like, "Ooh, ooh." Or you watch the show Botched and you're like, "Oh my gosh, I'm gonna end up on that show." Less is more. And then, like you said, look to your injector. If you're looking for an injector, most people have an Instagram page, so go look at their work. I mean, somebody might want more of a natural look. Somebody might want to be a little bit more full in certain areas, and that's okay. Like there's different methods of using it, but if you want somebody with a specific style, which I think you have a more natural approach to your practice, just look at their work and what they've done in the past.
Sure.
Yeah.
Less is more, truly.
Yes.
And I think the other thing that I see a lot is that we forget where we start. I see this a lot in young girls, especially the trend with big lips, right? So we'll do lip filler, and I think that's really pretty because there's a semblance of balance to the face as well. And I'm very big on that. Like we can't upset the balance of the face or you look injected. And for me, like I get really picky. I want my clients to look good, but I never want them to look injected if I can help it. I know there are some people who prefer that look and that's okay. But, we'll do a lip filler treatment, and then I see them back in my chair 3 months, and I thought, "Why are we here?" And she's like, "Well, I want I can't see it anymore." I'm like, "You can, but you forget where you started because you get used to seeing yourself in the mirror and you think it's gone, but it's really not." And I think over time, that's kind of where our industry goes wrong, and then sometimes we get some injectors who won't say no. They
They have
won't
to
have
just
that
say
mom approach.
yes.
Yeah, to where they
Yeah.
won't, yeah, they just say yes, and then that's kind of where we go wrong with it.
I love that you do that because you're really looking out for your patients. Like, you want them to be happy at the end of the day. And sometimes we don't know what's best for us. So, like, for me, I will say I've have never told anybody this, but I have filler. We just did my lips too. And I think that's a testament to how well that you did because they look so natural and nobody has said anything to me.
Right.
Nobody. Like, even the ultimate test was going to church with my mom and then going to breakfast. And she knows me since I came out of her womb. She did not say a word. And to this day, I still haven't told her. So she's going to watch this and be like,
Like,
Danielle, how did you do that? Why? Why'd you do that? But they look so natural, but I love your approach to that because I've even come in, like we did filler on my cheeks so I could have some cheekbones instead of my, my chipmunk cheeks, which they made a huge difference. And I even came back in like a year later and I was like, do you think I'm ready? And you were like, no, no. And I love that because you're just like tough love, brutally honest. And that's what you need in this industry because when you take it too far, it's hard to reverse it.
100%, and I can tell you that from my own experience. I've spent a lot of time this year dissolving some filler from my
Mm,
previous years. Not that it's bad, it's just it wasn't where I wanted, and I often see that where we get into trouble is underneath the eyes.
really? You can
Be-
do filler underneath the eyes?
that's why I get a lot of requests for that because people feel like they look tired, and I get that. I mean, nobody wants to look like they're tired. The problem with that area is the lymphatic system under there is so intricate that once, a lot of times once you block it with filler, it gets hard later. A lot of people think, oh my gosh, my filler's gone after like 6 months. Well, we now know by studies that even 7, 8 years, we find it still in place via ultrasound that it will still be there. So it doesn't go away as fast as what we think it does. For some people, it does. Some people will burn through it faster, but a lot of people,
Depending on, like, your metabolism?
yeah, it has more to do with oxidative stress within the body.
Okay,
So the more oxidative stress we have, the quicker you'll break it down.
interesting.
Uh-huh.
I'm
Yeah, which
learning so
which is,
much.
I know, lifestyle, right? It's all lifestyle factors. Sometimes it's genetics,
Yeah,
but a lot of times it's lifestyle factors,
gotcha.
alcohol, smoking, bad diet, all the things like that. So,
Which leads us into our next question. So
hmm
we've talked so much about products and treatments that are beneficial, but that's only a piece of the equation. So
correct.
what are some lifestyle choices that we should be making to, well round our whole skin like health in general?
So first and foremost, water intake, right? Hydration of the skin is not only going to come from external sources, but internal sources. So the more water you drink, the more soft your skin is, the more supple it is. So lots of hydration. Secondly, it's going to come down to diet, eating a healthy diet. And people say, well, Cheryl, I can't. I'm like, I get it. I have 2 kids.
It's hard, but it's like, don't be so hard on yourself. Don't try to be 100% perfect. Do like an 80-20.
Yes.
Enjoy your french fries with your kids if you have to. But like for the most part, get in your greens or drink a smoothie or something.
Yep.
Yeah.
Yeah. I find that people who, try to follow that healthy lifestyle of like a good diet, they do have better
And
looking skin.
exercise
Yes.
too. It's so
Yeah.
important.
Yeah. I mean, I can't tell you, speaking on that, how much my industry correlates with the fitness world, and that slow and steady wins the race, right? And that's why I always tell my clients, like, it's really fun to see them over the course of 2 or 3 years, and not only for me because I get to develop an awesome connection with my people, which I love that.
Yeah. You're a
I
people
love my
person.
I do, I love
Yeah.
my people, but it's really fun. If we'll look at subsequent pictures over years, and I'm like, girl, like you have aged backwards, but it's nothing drastic, right? It's just slowly over time, which I think about with fitness too. Like, it's really hard, if somebody's looking to lose 5 or 10 pounds and they get frustrated. And I'm like, it doesn't happen overnight. And that's kind of how it is with skincare, and even my industry is it doesn't happen overnight. It's the long game.
Yeah.
We stick with the routine, and the more you stick with it, the better it becomes.
Yes,
So,
absolutely. Like no ingredient is better than consistency.
correct.
Yeah. So just
1000%.
don't be so hard on yourself. Just
Right.
take it one day at a
Right.
time.
I get some of these young girls and they're like, I got a zit because I didn't wash my face. I'm like,
Ugh,
no. I'm like, I cannot tell you how
it
many times,
happens.
like, I come home from work at the end of a week and I am tired, and I will be the first to tell you I fall asleep sometimes without washing my face. And I know
Ah.
that that's terrible and not often, but like, it
Yeah.
just goes to show, like, and maybe I'll get one, but who cares?
Yeah.
Like,
Just put some charcoal mask
Yeah.
on it and then go to bed. You'll wake up feeling like a
Use a
new
little spot
woman.
gel treatment.
Yeah,
Like,
there's so many great
it's
ones.
fine.
So what if
Like, you have
somebody
to live
does
life.
have like a cyst, which I'm thinking of because I always get cysts like right before my period starts. I have one.
Mhm.
Luckily, it's on my back, so I can hide it with like a
Yeah,
t-shirt.
right. Right.
I always prefer to have them on my back if I'm gonna
Yeah.
have a cyst. But what would you recommend like for to treat that? You know, usually for me, I just put like a charcoal mask on it and I'll sleep in it literally, and I
Mhm.
wake up and it kind of like dries it out. But
Yep.
is there a better way to treat those things?
Charcoal mask works. Some of the other companies will make kind of like acne spot gel. Some people will choose to put like a mandelic acid kind of spot gel treatment on.
What
Some
about
people
those
will
little like
choose.
circle pads that people put on? What do you think about those?
I think they're fine if you use them for like an hour or two. I think if you leave them on for an extended period of time, if you don't follow the directions, you really can damage your skin horribly. So I think as long as you're following the directions, they're fine. Epion's makes a purifying spot gel treatment. I tend to like that because it helps with the redness too.
Yeah.
The trick is you have to use it. Like I have
Mhm.
a 17-year-old son who struggles with acne and he's like, "Mom," I'm like, "Are you using what I told you to use?" No. Well, it doesn't work if you don't use it.
He's probably like every other guy where it's like he needs the 3 in 1, like the shampoo, the conditioner, and the body wash in all one product.
So true. So true. But
Yeah.
yeah, I mean, you could just kind of have to mess around with that. Sometimes benzoyl peroxide will work. Benzoyl peroxide tends to be pretty harsh, so unless you have thick, oily skin, it's not going to be for everybody. So I
Yeah,
think
so if
that's
you run
just
on the
one.
drier side, maybe not.
Yeah, so that's just going to be something you have to kind of play around with and kind of figure out your skin.
Yeah, yeah. UV rays, we've talked about that. Like that's also important, like lifestyle choice to avoid that. Like, but there's also different ways to avoid it as far as not just using SPF. Like for me, I got my car tinted because we don't realize how much UV rays come into our car just from driving around. And when you think about your driving like that, especially that left side of your arm, like
Uh-huh.
your neck and everything can be hit with the rays. So
Hmm.
I think that's really important too. Like get your car tinted.
Yep, get your car tinted. Or like I have a lot of people now who are getting ready to go on spring break. And they say, "Well, sure, I want to do this laser, but then I'm going to be on spring break and I'm going to be in the sun." I said, "Totally fine. I will be the first to tell you I love the sun too."
Mhm.
Um, my trick for that is find a good tinted sunscreen that's a little thicker and double layer it.
Which I started using is it the Elastin tinted SPF, and I love it because it is a little bit more, it's thicker and
It
it has a little
is.
bit more coverage. So I'll tend to use that when I want more coverage or if I really know I'm in the sun, and I'll even bring it down like to my neck and my chest.
Yep. Yep. So I'm kind of weird. I don't like tinted on my neck and chest. I don't know why. So I tend to I have one from Elta that I like that's a non-tinted, that's a physical. I tend to be more of a physical sunscreen girl than a chemical. There is a difference. So if you look on the ingredient labels, your Neutrogena sunscreens, which I think is an important point to touch on because I get a lot of clients who tell me, "Oh, I use Neutrogena 100." You can't really get an SPF of 100, but it is all of those are chemically based. So if you look on the back of the label, they'll have on the ingredient list, they'll have like all of the ingredients that start with really weird names like H's and the O's, like oxynacate. Those kind of sunscreens have to sink into your skin, cause this chemical reaction in order to block the sun rays. And the problem with those is that the chemicals are only actually active in our skin for about an hour and a half max. So those really do require you to reapply every 2 hours. Whereas a physical sunscreen that has strictly titanium and zinc
And
oxide,
is that mineral based? Is that
that is
why?
physical,
Okay.
and those literally just sit on your skin. So I prefer those, especially for my women who golf and are outside for 4 hours, or you're going to be out on a sunny vacation. Use a physical sunscreen because it really just sits there, but then double layer it. So I took my kids down to Florida last year, and where the sun is way more intense. I put a layer on, waited a minute, put another layer on. It does feel a little bit thick, but I'll tell you what, my face did not see an ounce of sun.
Yeah, yeah, and you wanna be protecting that face for sure, and then that physical, like, sunscreen, it, reflects the heat too, so with the chemical, is it true that I feel
It
like I
actually
read
can bring more heat into.
it can absorb it into your skin instead of reflecting the heat, which is when you think about people with melasma, you wanna reflect that heat, you don't wanna absorb it.
Correct, correct. And also these new physical sunscreens like the Elasta one that you're talking about, we now understand that iron oxide is in those as well, which helps prevent against blue light damage from like our computer screens. Because how many times do we sit in front of computer screens?
That's a very good point.
Especially for somebody who has melasma. So now they're making them even better yet, so that for other skin conditions like melasma, it's going to be better yet too.
That's amazing.
Hmm.
Wow. Are there any other lifestyle choices that we should be making aside from skincare and procedures and stuff like that? I mean, obviously, we talked about diet, like avoiding the greasy food and stuff like
Yeah, yeah, yeah.
that.
Yeah.
You are what you eat.
Correct. Gosh, I think everything in just in moderation. I think, if you get confused, go visit with somebody about what should I do next. Don't try to guess it on your own. Because I'll tell you, like, even when I first started in this industry, the skincare products that I chose, my skin did not like them. I didn't understand at the time that I have super sensitive skin and my barrier gets upset easy. And so I was using skincare, medical grade, because I had just gotten introduced to it in my job. And about a year later, I'm like, why does my skin look terrible? And I kept adding more, thinking I just need to add something else. And then my skin would look worse until I understood I actually have sensitive skin. And the more I add, the worse it looks. So I think if you're not getting what you want out of the skincare that you bought online, that you saw, or whatever, come visit with somebody, because I see that a lot where people think, oh, I'm going to pick this, this, and this. And then they come into me and they're like, yeah, but why does my skin look like that? I'm like, it's too much for your skin.
And that's a great point too. You guys do free
We
consultations
do.
at Renu Med Spa. So
Right.
if you're local to St. Louis, reach out to Cheryl or reach out to Renu, because you can address your skin concerns without ever spending a penny.
Correct. And that comes from my education background. I just love teaching. And I think for me, like, that was kind of what set me on my goal to start my Instagram account in the first place, is that I would surf through my feed, and I would see all these things. Somebody who's not in this industry, and they get so confused, and I'm like, I just wanted to be that beacon of, hey, if you really want the
Truth.
nuts and bolts, here's what it is. I'm not like in this to sell you anything. I just really want you to understand, because I didn't understand. But I also
Yeah.
come at it from a place that, like, if I wasn't in this industry, like, my hard-earned dollars are my hard-earned dollars, and if I'm going to spend them, I want to get my biggest bang for my buck. So I want somebody to be honest with me, and that was kind of how I've always led, in what I do, is that I want to be honest with you, because if you're going to spend money with me, I want to try to get you results.
Yes.
That's where
Absolutely.
my industry kind of gets challenging too, because then I have to understand expectations
Hmm.
and understand if I can meet expectations with non-surgical things. So,
Right. Like maybe not every client is for you. So
correct.
do you ever refer people
I
out?
do.
Yeah,
Yeah.
which is great, because I mean, some people may be looking for something that you can't offer, and that's okay. I just thought about another one too. We have hard water in our houses. And so if you are more prone to dryness, we just installed a water softener, but that can play a huge impact in skin problems, is just the water that you're taking a shower with. So I think a more affordable option would be to like get like a shower head water filter. But if you have the money, it's a little bit more expensive, like get a water softener installed, because those minerals can really break down your skin and just cause dryness.
And build up and all that stuff.
Yeah,
Yep.
yeah, especially in your hair too.
Mm-hmm.
Yeah.
Yep.
Are there any areas of the body that people you feel like they neglect?
Uh-huh. Neck and chest.
Yeah.
I cannot tell you how many times.
Hands?
Yeah, and hands. And that, so it's funny. One of the a surgeon I used to work for a long, long time ago, when I was learning how to do vein injections, he would always say you could tell a person's age by their neck and their hands,
Yes.
right?
Yes.
And so I will tell you, I didn't really start doing anything to my neck until COVID, when we were stuck at home for so long. And I thought to myself, why am I not putting sunscreen on my neck? It's
Mhm.
kind of silly.
I literally just started doing this, and I'm like, "Oh, if I'd only started when I was 20, here I am 35." I'm like, "I guess it's time."
I mean, I was 36 because I'm 40 now.
It
Um,
still blows my mind.
yeah, but it's funny. I mean, I think those neck and chest we often neglect. And then hands too. I mean, you think about, like, when you're driving, it's exposed to sun.
So whatever you're using on your face, just bring it down. Like, your face ends at your boobs, you know?
Pretty much. Sometimes people are better about covering up their chest, but for sure,
Yeah.
people forget about their necks.
Yeah, yeah,
So,
yeah, that's an important one. And hands too, like you said, like age, that can just give away your age instantly. So now whenever I'm doing like my SPF, I'll just rub it on my hands, and then I won't wash them. I'll just
I was gonna say that's the challenging thing, because we're such in an era where we're washing our hands all the
washing
time
our
with hand
hands
sanitizer, so
constantly.
hands get a little
I'm
hard.
just gonna be like Michael Jackson and
I
start
know.
walking around with
Gloves.
gloves, like white gloves all the time. I'm
Yep.
protecting my hands.
Yep. Yep.
20-year-old hands.
Hmm.
So to wrap up, do you have any like skincare myths out there that you want to debunk?
Hmm. I would say, so the one myth I think that I hear a lot is, how about retinols?
Yeah,
Retinols are always a big topic of
I've never
discussion.
used one. Yeah, I'm interested to hear this.
Okay, so a long, long time ago, people thought I have to use a retinol in order to get rid of my wrinkles. So the research study that came out behind that basically said you had to use it twice a day for a year in order to help prevent wrinkles, which, let's face it, nobody can tolerate a retinol that often, right? So the reason we use a retinol is it's going to help speed up skin cell turnover, right?
Mm-hmm.
So instead of 28 days, we'll turn them over a little quicker. There are some really good benefits in terms of like reducing pigment and just kind of thinning out the skin a little bit so it looks more yeah, like younger, refreshed. So I do think retinols play a role, but I think sometimes we get caught up on I have to have a retinol and I have to use it every day. And then what I see is people come in super irritated and they're really frustrated with their skincare routine. And I say, well, what are you all using? And they say, oh, I use this retinol, this really strong retinol every day. I'm like, no. So we actually only need to use a retinol up to 3 times a week in order to get the benefits of skin cell turnover.
Gotcha. No, so not every day.
No, you can work up to every day. A lot of that too is going to depend on, is it prescription, is it non-prescription, how is it formulated? Because retinols have to be converted into retinoic acid in our skin in order to be usable. Okay, and so depending upon how it's formulated by whatever skincare company it's making it, if there's multiple layers that it has to break down to retinoic acid, the more irritation it's going to cause. Because there are some medical grade skincare lines where there are retinols that I tolerate and there are some that I don't tolerate well because I'm just sensitive. There's too many breakdown chains and I get this irritation from it that it just doesn't work. There is some semblance of you have to kind of work up to it. And so
So if you're gonna use a retinol, maybe just start.
you start slow, right? So you will kind of go through this period of maybe a little bit of dryness. You just have to be careful that that dryness and irritation doesn't flip to the extreme because then you're doing your skin a disservice. You do
Yes.
have to kind of get to this place of buildup of tolerance of it. And so that can take up to 8 weeks. And I think some people, we live in this world of instant gratification.
Instant.
It doesn't
Yeah.
happen like that.
Yeah. Like they put on the stuff and they're like the next day they're gonna be wrinkle free.
That's where the consistency comes in, maybe for a couple
Your skin
weeks.
is an organ. Like,
Correct. It's our largest organ of our body. So maybe you start out twice a week using it, for 2 weeks. And then if you do okay with that, maybe for the next 2 weeks, you go to 3 or 4 times a week. And if you do okay with that for the next couple of weeks, we slowly increase to allow our skin to become used to it. And if you can work up to every day, great. If your skin tolerates it, I do see my patients who can work up to every day for some skin types. Their skin does look really, really good.
yeah, I envy those people. I'm like,
Uh-huh.
you can handle so
I
much.
know.
I'm over here like a
I'm not one of,
sensitive, like
yeah, I'm
sensitive
not one of
girl.
them. Unless it's a certain like the elastin one is formulated well. I can tolerate that one every day. So it's just different. I mean, they're just
Is there
formulated
any other
differently.
like intense ingredients that people need to look out for?
Niacinamide is a really popular one because it's a great ingredient for barrier repair, believe it or not.
Where is that usually found?
Moisturizers,
Okay.
a lot of moisturizers will carry them. A lot of treatments will carry them. What I found out the hard way is that there were 2 treatments I was using. This restorative kind of skin serum, and then also like um, kind of like a multivitamin for your skin kind of product. Both of them had it in there, and then if you use too much of it in the same sitting, you can get this intense flushing where your skin gets super red, super warm. It's just too much at once, and so just things like that. There's a new ingredient, bucaquiol, that's out there that's popular. It's a form of retinol. um, Sometimes people can get sensitive to that because it will mess with their microbiome, and that's something we didn't really touch on, but that is developing as research comes, is that we have this certain microbiome to our skin. So we all have bacteria in our skin. That's normal.
Yeah, I mean, we all know about the microbiome in our gut.
Right. Same is true of our skin.
I had no idea.
So when you see skin conditions like rosacea, that's often a disturbance in the microbiome of the skin, which is why they flare with redness. But certain ingredients like that sometimes can mess with microbiome, and that's still an emerging field. So I follow a lot of scientists and podcasts on that. So I'm still learning myself that as research comes out, some of these ingredients, although they're good for some skin types, can really wreak havoc on other skin types. So,
So maybe not good for all. So if there's something new that's coming out, maybe just be a little bit careful at first. Do your research.
and if you don't understand it, go ask somebody about it, and they'll be able to tell you, hopefully.
Yeah.
But
Perfect. Are there any other myths that you want to debunk before we wrap up?
hmm, hmm.
Hmm.
That's a good one. I don't know. I think probably the myth would be that, I hear a lot of sometimes my older clients are like, I don't know why you guys do that. And I will tell people like, I've been doing this since been in the industry for 13
It's a
years.
long time.
But yeah, a long time. And I think they all can do well if you use them appropriately, in terms of injectables or lasers. I will tell you, I'll be the first to tell you I love lasers. You
Mm-hmm.
know this.
Mm-hmm. Yeah.
Because my idea is it like if I'm going to work out and I'm going to eat healthy to try to keep my body healthy, why would I not do them to keep my skin healthy? I'm not doing it because I want to look, super like 20, super young the whole time.
We just want to age
Why
gracefully.
would I not want to keep my skin healthy if I'm
Yeah,
doing all the other things to keep my body healthy?
absolutely.
It's kind of the approach I've always taken.
And it's an investment in your skin.
It is. And then in terms of injectables, do you need them? And that's what they'll say, well, what do I need? I'm like, you don't need anything.
No, you don't.
You don't. But like injectables kind of come in nice. Like if you want to do the preventative route, we can help slow down the lines and wrinkles. I can't stop them forever because you're going to age at some point, but we can slow the process down.
No, it's not really all about anti-aging. It's more about damage control because you can't turn back the clock. But moving forward, we can do things and take steps to minimize our risks, minimize the damage.
And I can tell you, preventing them is often way easier than treating them. Once it's the lines and wrinkles and sun damage is set in, it
It's
gets a little,
there.
yeah, well, it gets just harder to treat and people get frustrated because they're going to throw a little bit more money at it. And they think, gosh, and I'm like, if we do this routinely every year, you can actually slow that down. And,
Yeah.
and once I get people to understand that piece, they're like, oh yeah, I'm like, see,
Yes.
your skin
Yes.
does look better after you take care of it.
Thing about Renew, where you practice, is you guys have a VIP program.
We
And I
do.
love that because it makes it more affordable. I mean, we all know how expensive this is. We can really we're putting in our hard earned money. Like that is people's livelihood. But with the VIP program, every dollar, there's 3 different tiers of it. So like whatever you want to focus on. But
They're
you
basically
every
banking dollars.
yeah, it's like a skincare savings account, basically. So every money that you put in can be used towards like a procedure or treatment. And then bonus, you get like a birthday gift, you get freebies, you get access to the VIP pricing, which is like severely discounted. So I think that is great because you guys are allowing it to be more affordable for people.
Especially when, we live in this day and age of inflation and everybody's like, everything's expensive. It is.
Everything's expensive. So maybe like skip going out
I
so
know, right?
much, like skip the alcohol.
That's right.
Put it
That's
into
right.
skip your Starbucks order.
Yeah. Yeah, that's right. That's
Put it into
right.
the VIP program
Yep.
and invest in your skin health.
Yep.
Yeah. Well, is there
So,
anything else you want to share with people before we wrap up?
no, I think more just to kind of change. My goal is always to kind of change the narrative around it. I see a lot of times on social media, people are like, "Oh, you have to do this, this, and this, and this to look good." You don't have to do anything. We can go at it snail pace, or we can kind of hit it hard and hit it fast. I am there to basically kind of be your guide and tell you when, oh, yes, this will help, or no, we don't need to do that right now. But like, we'll get you there. But I think for me, I just want to kind of change the narrative and help people understand that you don't have to look fake. You don't have to do all these things. Like, we can do them in moderation and you can still look like you. You can just look like a more rested version of you and a healthier version of you. And I think that's really where I come from is I want you to look healthy and I want you to look your best naturally, even if we do injectables.
Yes. Yeah, a
So,
natural approach, like less
yes,
is more.
100%. Yeah.
So, where can people find you on social media in case they want to reach out?
So I'm on Instagram at Cheryl Hazen RN. I'm also on Facebook. I have the same handle on Facebook. I actually have a business page on there because my Instagram will post it there. I'm not as big on Facebook. I tend to be on Instagram quite a bit.
Instagram's king.
I know.
You post a lot of informative reels.
I do. That's kind of the name of my game. Although, if anybody has any hints, let me know. Sometimes, I get to this place where I teach a lot and then I feel like, well, I've already talked about that. Nobody wants to hear about that. And I get kind of at a loss for, well, what do people want to know about?
Yeah, let her know what you guys want to hear
Yeah,
about.
yeah, yeah.
Yeah, and then for Renu Med Spa, you guys can follow them at, I think it's Renu_Med_Spa. Yeah.
We
Okay.
just redid our website too, so it's kind of
That's right.
fun.
That's right.
Yeah, so in case you have questions on there, you can look. We put some good information on there. You can book a consult on there because it'll go directly to our patient portal. So
Yes, book your free consult, get some free advice.
yes,
Everybody loves free. Well, thank you so much for being here
thank you for having
today.
me on. This is fun.
Yeah, I know everybody's just going to love hearing from you today, like I said. So reach out to Cheryl if you guys want a free consult. Hit up Renew Med Spa if you guys are looking for treatments or skincare products, or just if you're trying to improve the health of your skin. So thank you so much for listening, guys, and I'll see you guys next time.